take a closer look at mental health and resilience during the disability within the disability community during COVID-19. We are so thankful that you're with us. This is an extremely hot topic and a very timely topic. And we're very excited to be able to bring this information to you. I often say time's the most valuable thing we've got. And so thank you for spending this time with us as we move through this important conversation and share some resources. My name is Carolyn Phillips, and I am the co-director of the center here at Georgia Tech, the Center for Inclusive Design and Innovation within the College of Design. And I also have the great privilege of working with your awesome presenters today. Danny and Kate and Susanna have just a wealth of information. I've been working with all of them for many years and have learned so much from all of them. And I'm going to have each of them introduce themselves. So Danny, go ahead.
Yeah, my name is Danny Housley, and I'm the Assistive Technology Acquisition Manager with Tools for Life within the Center for Inclusive Design and Innovation. So I work a lot with individuals throughout the state when it comes to acquiring assistive technology to actually get some of the wonderful things that we demonstrate. And I work a lot within the community outside of my work in a lot of different roles. So I'm happy to be here today to share some of the resources and things that I've learned throughout this time.
Thank you so much, Danny. Kate, I'm so glad, Kate Brady, that you're with us today. And if you'll introduce yourself.
Sure. Thanks, Carolyn. Yeah, we're so excited to be joining you and Danny and Susanna in this webinar. We value Tools for Life and the CDC as partners. I work at the Georgia Council on Developmental Disabilities as the deputy director there. And in that role, I manage our public policy, public information, transition, employment, and self-advocacy work. And look forward to talking with you more.
We are so lucky to have you in our state because I know you've done all kinds of work on a national level, and I'm so thrilled that you're back with us in Atlanta and serving the state of Georgia. And I'm going to turn it over to Susanna, who's going to introduce herself.
Hi, my name is Susanna Miller-Rains, and I am the Operations Coordinator at the Center for Leadership and Disability at Georgia State University. I wear a lot of different hats, but one of my hats is I am a social worker by training, a clinical social worker by training, and I am the social work coordinator at Adult Disability Mental Health or Medical Home. We're on a mental health call. Sorry. So I support our patients who all have intellectual and developmental disabilities with their mental health needs and any other kind of community resources that they need. I also am a youth mental health first aid instructor, and I've been doing that for the last 3 years. And I've also been co-coordinating the Georgia Developmental Disabilities Network COVID-19 calls, which we'll talk about a little bit later. And we're just really excited to be able to talk today and to share information and hopefully help people with some resources that they need.
Thank you so much. And congratulations again on being on the board of AUCD, on the national board. So proud of you. And I'm so impressed with Kate and Susanna and Danny, the work that they instantly started working on, getting right into action and seeing it was back in February that you immediately were like mental health and started jumping in on this. One of my degrees is in counseling, and I have a deep respect for folks who are there at the right time in the right place, and definitely want to spotlight the good work you've got and all the resources. So, and I wanted to also thank Hannah and for being our ASL interpreter, so talented, and also Heather. We absolutely believe in being as accessible as possible, and so you're going to see that as something we don't just talk about, but we actually do. So as we move through this, just wanted to make sure that you're aware that we definitely have both of those ways that folks can engage. And I'm going to turn it to the fabulous Liz Prasad, who's going to talk with us in more detail about tips for this session. So Liz, take it away.
Thank you, Carolyn. Hey, everyone. I'm Liz Persad. I'm the Program and Outreach Manager at Tools for Life with CIDI at Georgia Tech, and very excited to bring you today's webinar, as well as all the other webinars in this COVID-19 Accessible Materials webinar series. So just some quick tips for today's session, and then we'll jump right into the content. Just so you know, today's webinar is being recorded. The webinar recording, transcript, and accessible presentation, as well as anything else that needs to be wrapped up in this package, will be made available to all of you to view the recording. That will be posted on a Georgia Tech website focused on this project, and we'll get some of our co-hosts to type that in the chat area as well. Obviously, we have the wonderful Heather on. She is providing captioning today. You can select your captions within Zoom by selecting Show Subtitles, or you can click directly on this link to pull up a separate window for the captions from Heather. We just ask that if you're not actively speaking, that you please mute your microphone. We have our co-host also keeping track of everything as well too, but if you could just help us out. We have got a lot of people in the room, which we're very excited about. We just want to make sure our presenters are able to be heard by everyone. Please utilize the chat window to ask questions, post your comment throughout today's presentation. We're hearing from a bunch of you already from your location and your organizations that you're representing. Thank you so much. But if you've got any questions, comments, please feel free just to pop them right in the chat, and between myself and other co-hosts and presenters, we'll keep an eye on it. There will be dedicated time at the end of today's session focused on Q&A. So you will have an opportunity to use the raise your hand feature within Zoom and to unmute your microphone and talk to any one of our presenters as well. Thank you. So let's jump to the next slide. Thank you, Danny. I wanted to let everyone know that we are offering continuing education credits for this webinar, as well as all the other webinars in this series. That is also true if you are unable to make the live session, your colleagues, your community members, and you're able to view an archive. You can access our CEUs and CRCs for the archives as well too. So we are offering two types of credit, CEUs and CRCs. CEUs are approved and distributed by the AC Institute. CRCs are approved and distributed by the Commission on Counselor Rehabilitation Certification, or CRCC for short. If you're interested in receiving CEUs or CRCs, I believe that you already indicated that on registration, but please feel free to reach out to the training email right here. We'll get some co-hosts to type that in the chat as well, but that's training@gatfl.gatech.edu. And then, of course, eligible participants will typically receive credits 2 to 6 weeks after the webinar. But again, just reach out if you have any questions. All right, I'm going to turn this back over. All right.
Thank you so much, Liz. Huge thank you to our funder, the CDC Foundation. That's the reason why this whole webinar series was made possible. It's due to funding from the CDC Foundation, along with technical assistance from the Centers for Disease Control and Prevention. You'll hear us several times refer back to the guidance from the CDC, and because there is such excellent guidance there, and continues to actually move the whole conversation and keep us up to date. And so thank you so much to the CDC Foundation. And we'll move to the next slide. We're going to be talking today about, COVID-19 pandemic as it continues to have an impact on our lives and our mental health. No doubt about that. Many people are experiencing a heightened anxiety, social and physical disconnection from others, and ongoing concerns. We're concerned, obviously. Some of the unique challenges and surprising outcomes have emerged within the disability community. A lot of solutions that are happening there. And while many folks with disabilities have faced considerable social and mental health challenges, others are actually, reporting experiencing increased inclusion and more connectedness than before. And that's a very exciting moment to kind of pay attention to, and what lessons can we learn. And there have even been some really great articles about that in mainstream media. And we'll move to the next slide. So our session description. This webinar, what we're going to do is explore some of the various factors for understanding mental health and resilience of folks with disabilities during the COVID-19 pandemic from their perspective, from our perspective. And as a person with disabilities, how does that manifest and what does that look like? And I'm so glad that we have folks that are here with us. I'm happy to share, and other folks are too. Discussion will also center around how service providers can access resources to support their services while learning how to recognize the signs of mental health difficulties within the disability community. Participants, you will actually receive some tips and resources and also some guidance for improving mental health and also building resilience. And we'll move to the next slide. So our learning objectives, what we really want to impart and what we want you to get from this and is really to be able to identify 3 impacts of COVID-19 on mental health from the perspective of those of us, individuals with disabilities, be able to describe 3 tips for building resilience, and then also identify 3 resources to support mental health and overall health for individuals with disabilities, including ways to recognize early signs of mental health distress. So paying attention to all of that. As I said, we are happy to be here with you today from the Center for Inclusive Design and Innovation here at Georgia Tech. We are all about accessibility. We often say accessibility made smart, focused on accessibility consulting and Braille services, captioning services, obviously looking at electronic text, and all kinds of work in that space of assistive technology. And there's so much intersection there when it comes to working with individuals with disabilities and really moving that forward to help everyone have mental health addressed and also give support wherever we can in building that resilience. So I'm going to turn it to Danny, who's going to talk with you in more detail about Tools for Life and also a whole lot more about some of the solutions. So Danny, take it away.
Yeah, so as Carolyn said, Tools for Life, we are a part of the Center for Inclusive Design and Innovation. And up here is our mission statement. So Tools for Life, we are the ATX program. We're dedicated to increasing access and acquisition of assistive technology, devices and services for Georgians of all ages and disabilities so that they can live, learn, work, and play independently and with greater freedom in the community of their choice. We really take a very person-centered approach. We focus on the individual and identify the barriers that they're encountering to help find solutions for that. And there's an image here of Tori Holder on the left, myself in the middle, and Liz Prasad on the right. This was during another webinar that we were giving clearly a while back since we're sitting beside each other. So that's Tools for Life, and we're gonna go into introduce you to our partners that are gonna be working with us today.
This is Susanna Miller-Rains, and I work at the Center for Leadership and Disability at Georgia State University within the School of Public Health. We are a university center of excellence in developmental disabilities. We are one of 2 in Georgia. The other is the Institute on Human Development and Disability at the University of Georgia. Our mission is to translate research into sustainable community practices that contribute to independent, self-determined, inclusive, and productive lives for people with disabilities and their families. We are a member of the Georgia Developmental Disabilities Network, which is called for in the Developmental Disabilities Act. So we are all charged to do different areas of work to support people with intellectual and developmental disabilities throughout our state. And we also have lots of national collaborations. And we are just really excited that, we have the opportunity to have such great collaborations here in Georgia. And I'll turn it over to Kate to talk about the Georgia Council, one of our DD Network partners.
Thank you, Susanna. Yes, so indeed, the Georgia Council on Developmental Disabilities is a part of the federally mandated DD Act, or DD Network, that is. Our mission is to bring about social and policy change that promotes opportunities for people with developmental disabilities and their families to live, learn, work, play, and worship in Georgia's communities. And DD Council's and ours in particular does its work through individual advocacy support through the development of self-advocacy. We also are the legislative arm of the DD network, so have a role in educating policymakers about the issues that are important to the community, and function in a role to disseminate information through a quarterly magazine and newsletter and other publications, and also function as a grant maker. So DD councils fund and seed new and innovative practices that meet the needs of people with developmental disabilities and their families. And next slide.
All right. So today we're going to be covering a lot of resources, and don't panic. It's okay. All those resources are going to be found at the end of the presentation, and you're going to have access to this as well. So if we go a little quickly or jump over something, don't worry. We will definitely make sure that you have access to all of the wonderful resources that we're going to be discussing. So first, I want to talk about some tools to support mental health. So this information comes from the Mayo Clinic, and it details some of the impacts that stress can have on different parts of our lives. So, you know, your body, there's physiological effects. You can have headaches and muscle tension, fatigue, and problems with sleeping. I'm familiar with some of those. It can also impact your mood, increasing anxiety, feelings of sadness, anger, or feeling overwhelmed. There's behavioral effects. So it could be over or under eating, outbursts, withdrawal. And you know, there's a lot of options to manage stress. You can look at physical activity and socializing. There's relaxation techniques that are available, and participating in hobbies. So we look at some of these impacts because stress, you know, especially during these times, can really impact our relationships and just impact our enjoyment of things that we normally took pleasure in. So we're going to look at some of the things that are unique stressors to the disability community. These were some items that have been identified both by individuals that I work with the Credit Able program and in my advocacy work, as well as the DD network calls. So we look at some of the barriers that are being faced are increased isolation, and that's a result of transit cuts, and that's mass transit. Here in Atlanta, we have MARTA, and I think it was 80% of the bus lines, the fixed route bus lines were cut. And then train service was impacted. So some people literally can't get on a fixed route bus to go to the grocery store to do the things that they need to do. Safety of rideshare and accessibility of ride shares are a concern. Not everybody can get into an Uber or a Lyft, either because of physical disability or because of impact of income. Not everybody can financially afford that. A lower availability of care attendants in various settings, and that's, you know, in your home. That could be in a setting, a hospital, or lots of different areas there. So sometimes the attendants weren't available because they had an exposure, and it could put the person that they're working with at risk. So that's a big issue. Lack of internet and phone access. We look at that especially in rural communities where there was already issues with getting connections, but then you look at the financial impact. There's a lot of different increased costs with living during a pandemic, whether that's attendant care or having to pay for grocery delivery. And then lack of assistive technologies. Not everybody can afford the technologies they need, or maybe they were relying on something like the library service or another option to have access to the technologies they needed to check email and to stay connected with friends and family.
Danny, if you'd like, this is Kate speaking. I can add a little bit about the impact on care attendants. Would that be helpful?
Yes. Oh yes, absolutely.
So one of the things we've been looking at the council through some work with a researcher at CLD actually, is the impact the pandemic has had on the relationship that people with disabilities have with their PCAs or personal assistants or care attendants, however you want to call them, direct service professionals, they're sometimes also called, and finding that the burden of PPE, the risk of infecting one another, the demand on a caregiver who isn't always paid an excellent wage to be aware of their activities outside of work such that they don't put at risk the person they work for and with. These are tremendous new and different stressors. We've also seen a difference, as Danny mentioned, in the availability because the job presents its own complexities, right? It requires a lot of proximity and so could be perceived as a difficult role during a pandemic. So I think there's been a tremendous impact on that very critical part of people's lives. And I'll turn it over to Susanna to talk about the next bullets.
Yeah, the next few are just kind of really important things to think about because these things were already hard before the pandemic, and the pandemic has made them much harder. So the lack of affordable and accessible nutrition, lots of individuals who are marginalized live in areas that are food deserts or that don't have access to healthy nutrition. And so it's just been really difficult for people to get the nutrients they need. The lack of safe and accessible communication, especially for people who don't use formal language and use assistive technology and other means to communicate. It's definitely been, an extra stressor. And then complications to educational supports. We hear about this a whole lot. It is very difficult sometimes to have the educational interventions that individuals need through IDEA or through their 504 plans in order to get the supports that they need in a virtual environment. And if there is lack of internet and phone access, then it has to be in a distance learning environment, which is a whole nother arena of having to figure out educational settings and at home settings with other supports that aren't being done in real time and virtually with teachers and paraprofessionals. And so it's just really, caused a lot more strain on students with disabilities.
And there are a lot of really good online resources when we look at these. As we mentioned, a lot of these were difficult barriers when there wasn't a pandemic going on, and now you have a whole different layer of complications. A really good resource to explore is from the CDC. It's their Coping with Stress resource page. So on here, they do have some specific resources for dealing with stress during an infectious disease outbreak or pandemic. They also focus on coping with stress in a healthy way, so that yourself and the people you care about and your community are stronger. We talked about some of those impacts that stress can have on you, and they want to make sure that we're mitigating that. And knowing that everyone reacts differently, and some may respond more strongly during a crisis. So on that resource page, you can find mental health and stress management resources. There's also resources for people that are currently in crisis. You have suicide prevention resources, and then also information for recovering from COVID-19 and ending home isolation, which is a whole different can of worms to get into. So definitely check out that resource page. Again, this is going to be at the end of the presentation. When you do get this, that is a hot link at the top that you can click on. So some other ways, some tips to look at on how to cope with stress. One is to avoid media that invokes it. So taking a break from the news, social media, podcasts that may be focusing on that. Find some time for yourself. Just some quiet time can be wonderful, because oftentimes we tend to fixate on things that make us more anxious. Here lately we've had not only a pandemic but an election and a lot of other factors that have invoked a lot of that anxiety. So avoiding that media, focus on your physical health. Looking at uh, incorporating workouts, whether it's just going for a walk or starting an exercise routine, um, focusing on mindfulness. So, looking at breathing techniques, doing meditation, practicing gratitude, which we're going to talk a lot about here in just a minute. And then changing up your eating habits, planning healthy meals and snacks. A lot of us are at home, working from home, learning from home, and it's really easy to go to some of those comfort things. But when you focus on changing up your eating habits, it can impact a lot of different areas of life. And then getting enough sleep, um, making sure that you're going to bed at a reasonable time, turning off that media so that you're not fixating and can go to sleep. Um, and then make sure that you're making time to connect with others and to do things that you enjoy. Um, our stress and anxiety can often take us out of the things that we love to do. So make sure that you're taking time to crochet or to draw or listen to music. Do focus on things that do bring you joy. And next up, we do have an image here. This is from the National Institute of Mental Health, and it's just kind of reinforcing some of those items. These are good to print out and just maybe post in the home, post in places where you can see it, just to remind you to take breaks from the news, make time to unwind, set those goals and priorities, take care of your body, connect with others, and focus on the facts. Um, those are things that sometimes we just need a little reminding of. Looking over and being like, take a break from the news. Great. Let me close that app out and turn on some music that I like. That is a resource you can download and print out, and you'll find that at the end. So, kind of refocusing things towards gratitude. Oftentimes, it's very easy to focus on the negative. Gratitude, it requires practice. It's a skill. It's more than just a buzzword. I took that directly from the resource here from the American Heart Association. Um, and there's a link here for thankfulness. The page is called Thankfulness: How Gratitude Can Help Your Health. Um, and so oftentimes, again, there's that negativity bias where we focus on the negative because it's the easiest thing to focus on. But if you practice on looking at things you're grateful for, you can have increased physiological effects, things like lower blood pressure and reduced stress, which are wonderful things, things that we want. Um, you can also share your areas of gratitude in a journal or with family and friends through a Zoom call or at the dinner table if you're living with folks. But just think about, what did your body do for you today? What are you grateful for? I went out for a walk and I was able to clock a mile or two when you were out there. What did you do that you enjoyed today? There's always things that we like and things that we've done that we're proud of. Share those. And whom do you look forward to connecting with? That could be now, that could be a week from now, it could be via Zoom or on the phone or through a letter. But thinking about what, who do we look forward to connecting with? And there's a lot of things to be grateful for. And it's just a matter of, again, practicing that skill and making it part of your everyday routine. And you can also, there's additional resources on gratitude from the How Right Now on gratitude, and there's a link there. It's howrightnow.org. And you can get even more wonderful tips and tricks for practicing that gratitude, getting that skill strengthened, which we all need in these times. So I'm going to go into talking about some tools for relaxation. As the AT Act, we want to share some of the wonderful technologies and things that are out there to help us with our mindfulness and gratitude, and again, doing those things that you enjoy. So the following slides, just as a reminder, the following slides contain a variety of options, but they are not an exhaustive list. There's a lot of other things out there. And this is not an endorsement of any particular products, services, or organizations. So our goal with these upcoming resources are just to let you know kind of what are the broad categories and what are some options that are out there. So first up, music. This is one that is very near and dear to me. I love listening to music. It does bring me a lot of comfort. Um, and there are other effects with music. There's effects on the memory. People with dementia have been shown to be calmed by this. It triggers some memories. The part of our brain that associates memories and music is not uh, is not impacted by dementia and Alzheimer's in the same way as other parts of the brain. Music can be great to accompany exercise. I know that if I'm out for a walk, if I'm listening to something that's a little more upbeat, I tend to increase my pace. If you're listening to something kind of slow and relaxing, you're going to go a little slower. Could be good for maybe meditation or that gratitude. And it can help reduce anxiety. Music definitely impacts our moods in a lot of different ways. So some options that we put up here, there's Apple Music. It's a streaming service through Apple. It's integrated in a lot of their devices. A lot of people use Spotify. You can use that as an app. You can go to a web browser and use it. And then there's YouTube Music as well. So just go into YouTube and they have playlists already established that you can play and listen to. And to the right of the text here, we just have the icons for Apple Music, Spotify, and YouTube Music. Another option is drawing. So positive effects of drawing are improved mood, concentration, a reduction of anxiety, and it can lead to an emotional release. Sometimes working through stress and working through our anxiety, putting that into art can make a big difference. Just look at any of the great artists throughout time, right? There's often, they created their pieces to release that emotion. And I do love to draw with pen and paper and ink and charcoals and all that. But I also enjoy using an app. I enjoy using drawing apps on my iPad. To the right here, there's an image of Eeyore from Winnie the Pooh, and the text reads, "Could be worse, not sure how, but it could." So that is just to remind you that for Eeyore, that is a very positive statement. um, because for him, things could always be worse, right? But this is something that I drew. I drew this with an Apple Pencil and using the Procreate app, which is our first example here. I was able to get the effect of charcoal and watercolors. So the great thing about using an app is you don't have to shell out extra money for art supplies. You can undo things, and it can really, again, you get that all of those positive effects of drawing. Sketchbook Pro is another option that's out there. It has a small fee associated with it, but again, you have a lot of variety when it comes to the medium that you're replicating on the screen, as well as when it comes to somebody maybe with low vision like myself. I enjoy this because I can zoom in on the screen and really get into the detail, and I can explore some of those different options again without having to spend extra money on resources when I'm already spending extra money on grocery delivery. So a good way of unwinding. Aside from drawing, we do have coloring. Benefits are it can help you work on motor skills. It relaxes the amygdala, which it holds a lot of that anxiety. It can help improve your sleep. So doing something like covering a mandala, and there's an image here of somebody using an iPad and an Apple Pencil, and they're just coloring in that mandala. It's something where you can really take your mind off of what's going on, and you just kind of focus on coloring that in. And the neat thing is you have options. You can have an app where you just tap the area and it's going to fill the color in, or you can do it where you have to actually swipe back and forth as if you were coloring on a piece of paper. And sometimes different people, depending on their physical ability, prefer those different options. So some examples to look into are Happy Color, Color by Number, Colorfy, and the mandala coloring pages. So again, you have a lot of ability to change the interaction that you're using with these apps, and it can really be a comforting thing to take part in. Um, I don't know if y'all recall, but maybe about a year or two ago, adult coloring books became very popular. So this is another way of, again, practicing practicing some different mandalas and not having to shell out extra money for paper and pencils. Uh, Changing up your your environment and design can also make a big difference. Smart home technologies can really help with making a relaxing environment. We have a image here of just a room that has some different colored lights in it. They're watching a TV. They probably have smart speakers set up there. But lights can really play a big impact on your mood. Um, Smart speakers, again, whether that's an Amazon Echo or a Google Nest or an Apple HomePod, having those can be your hub for controlling your lights and thermostat, your smart thermostat. That oftentimes, if you go through your energy management agency, they sometimes have discounts for some of these smart home accessories. And then adjusting natural light. One thing I learned throughout the pandemic was my apartment, when I wasn't normally here during the day, gets very bright and very hot. So I invested in some curtains to adjust the amount of natural light that would come in during the day. I'm light sensitive, so I was able to adjust the natural light and I have smart lights in my home as well. So I was able to adjust those to a color palette that reduced eye strain and really provided some comfort when I needed it during the pandemic. So next up, we're going to look at some resources for resilience, and I am going to turn things over to Susanna, because I'm sure you've heard enough of me for a moment, to talk about some of these signs of mental distress.
Thanks, Danny. I do have to say coloring and crafting are kind of some of my favorite ways to de-stress. Today, we wanted to talk to you so you could just kind of be aware of some signs and symptoms of mental distress. So it's important to think about these things within yourself, within your loved ones, and seeing, how they're doing and kind of what the impact of the pandemic on isolation, on a lot of other, factors that are weighing on all of us, how they're manifesting themselves. So some of the signs and symptoms, and this is not an exhaustive list by any means, but are feeling sad or down, someone having confused thinking or reduced ability to concentrate, excessive fears or worries, or extreme feelings of guilt, extreme mood changes of highs and lows, withdrawal from friends and activities, significant tiredness, low energy or problem sleeping, detachment from reality, such as delusions or having paranoia or hallucinations, having the inability to cope with daily problems or stress, having trouble understanding and relating to situations and to people, having problems with alcohol or drug use, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, as well as suicidal thinking. What we really want to think about when we're thinking about these signs and symptoms is how they impact someone's ability to function in the world. We all have moments where we feel sad or down, and that's nothing to really be concerned about. It's natural to feel that way. But when it begins to fully impact your life, your ability to live, your ability to love, your ability to do your job, your ability to go to school. So some of these that might seem a little minor, it's the impact that they have on your daily life. So just be mindful of these things. And when you have some of these things co-occurring, the impact is greater. So just things to be mindful about. Next slide.
So this next slide is a quote from Dr. Adolf Ratzka, who started the Independent Living Institute. He essentially brought the independent living movement to Europe. He'd worked with Ed Roberts and brought some of those ideas to other countries. And this quote just says, "Since we are the best experts on our needs, we need to show the solutions we want, need to be in charge of our lives, think and speak for ourselves, just as everybody else does." So, in a time where we are facing greater restrictions, people with disabilities are um, feeling even more as if things are kind of out of their control when it comes to, we talked about the availability of attendance and the availability of nutritious foods and things. Uh, Turning to working with uh, other individuals with disabilities, getting that peer support can be really important. Um, so peer support, it's the foundation of independent living philosophy, and that, at its core, independent living philosophy is about people with disabilities being in charge of their lives, being able to decide how the services are going to be provided, having community access, and just having the same rights as anyone else. There's an image here to the right that are two people that are manual wheelchair users and a gentleman using a white cane, um, connecting, having a conversation. And this is a group from California. But being able to connect with other people with disabilities can be a very powerful experience. So the National Federation of the Blind and the American Council of the Blind are two of the bigger organizations for people with vision loss. Our NFB chapter here in Atlanta, I sit on the board for that organization, and it has been a very important resource for our community to share information, to share loss, to grieve together for some of the folks that we've lost in the community, and to again share those strategies. What's worked well for you? What might work well for someone else? The National Association of the Deaf is another organization specifically focused on people with hearing loss. Being able to come together and communicate in sign language to share resources. Again, it's about connecting with other people with similar disabilities or life experiences.
Thanks, Danny. Some of the others that you'll see here are People First. And People First is a national organization of folks with disabilities, also the Autistic Self-Advocacy Network. Both have Georgia chapters, and ASAN is known for recognizing the interests of adults and children with autism who refer to themselves as autistic and want to be connected and supported in a way that doesn't incorporate cure modalities. So really important work that they're doing. ADAPT, some of you on the line may be familiar with ADAPT. ADAPT was critical in the independent living movement and is known for organizing action style advocacy, such as showing up at the Capitol and really helping the public understand the impact of issues on the community. And then Uniting for Change, folks may be less familiar with, but I'll plunk a link in the chat for everyone. That's a Georgia-specific consortium of folks with disabilities that the Georgia Council provided some funding to, so that advocates could be organized around the state and connected with one another and have an opportunity to set their own priorities. So all of these entities have a little bit different identities, but are wonderful venues for connecting with peers and articulating one's needs and participating in advocacy. I'll turn it over to Susanna.
I'll talk briefly about the National Alliance on Mental Illness. It's also known as NAMI. They do a wide variety of things, and peer support is one of them. They do a lot of education. There are affiliate organizations based within states and communities. They do a lot of different advocacy around things such as public policy. They have a helpline, which actually I'll share in a little bit. And they really kind of put out public awareness campaigns to really help demystify mental illness. And I'll turn it back over to Kate to talk about the Respect Institute.
Yeah, so the Respect Institute, I'm familiar with through work, and they provide support to folks who are in recovery, either from substance abuse disabilities or mental health disabilities, to reflect on, capture, and tell their stories in powerful ways. And I've had the privilege of listening to many Respect Institute graduates who offer to their peers, but also to the general public, a slice of their life experience. So I'll put that in the chat too if you're interested in inviting a Respect Institute speaker to an event that you're hosting.
Yeah, the Respect Institute is a wonderful group, and in Georgia, we helped with expanding their focus on cross disability. The focus at one point was primarily mental health and recovery, but we saw a great need and an opportunity for expansion, and so Disability Link here in Atlanta helped with expanding some of those focuses. So that
Oh,
was
that's wonderful.
right. So the power of connection. So we've talked a lot about the barriers that people have faced, but there have been good things that have come about when it comes to making connections. So tools that people with disabilities, especially some in rural communities, have used to stay connected are now being commonly used. Video calling platforms that a lot of people that are deaf have used for a very long time are now being used more often. Um, Teleconferencing platforms with the NFB, we've been uh, we've been using conference calls way before it was cool to connect with each other, both across the state and across the country. Um, and when it comes to things like cooperative gaming, um, connecting with somebody through the internet to play a game together, that could be an MMORPG, or it could be um, anything where you're working together. A lot of people are playing Uno online, and they're playing things. There's a service called Jackbox Games, which have a variety of party games that you can connect with people um, within your household and within, abroad to do that. And we're also including a link to an article here from the New York Times called "When the World Shut Down, They Saw It Open," and this features one of our advocates here in Georgia and her experience with looking at some of these issues that we just listed, or opportunities, not issues, that we listed, using those video calling, teleconferencing platforms to make those connections. And now that it's not just something that's kind of a niche thing, it's something where it's common, and we want to make sure that even after all of this, we're still able to stay connected, even if you can't be physically present. Right. So some state support agencies. There's a lot of different things we have listed here, and the great thing is the things that we're going to list here. We're going to talk about the ones for Georgia, but these are applicable to other states. Every state is going to have a technology act and some version of an organization that serves people with visual disabilities. So we'll hop in and let Kate start out with talking about DD councils.
Sure, thanks, Danny. So there is a Developmental Disabilities Council in every state, and they all act to provide funding for new innovative practices. They all do policy work. There is likely a Department of Aging and a state agency for people who are deaf or hard of hearing in every state. Let's see, I can turn it back to you, Danny, and then I'll grab the end there.
Yeah, so a lot of states also have those centers for the visually impaired. So these are organizations that are designed specifically to provide supports to people with vision loss. So that could be vocational resources, daily living, independent living skills, lots of different things. When you look into protection and advocacy programs, those are available widely, and they're there to make sure that people's civil rights are being protected. Sometimes they have programs to move people out of nursing institutions and back into the community. But it's making sure that our rights as people with disabilities are secured. Here in Georgia, I've worked a lot with our protection and advocacy programs when it comes to accessible voting and getting people access to supports and technologies to live in the community of their choice.
And Danny, somebody in the chat has mentioned Centers for Independent Living and also the Helen Keller Institute, which provides leadership around issues of deafness and folks who are deaf and blind.
Yeah, every state and territory has a statewide independent living council, but it's different for each state as far as what counties are covered by independent living centers. In Georgia, we have a very large swath of the state that is not covered by any particular center for independent living. But you look down to Florida and they have full coverage in their state. So every state is going to have that statewide independent living council, which kind of looks at the broad umbrella of independent living in the state. And then coverage by centers is going to be a little different depending on where you are.
Yeah, yeah. So a few things you'll see there on the list are state agencies that provide publicly funded services. In Georgia, we have the Department of Behavioral Health and Developmental Disabilities that administers the Medicaid waivers. They also administer public mental health centers, services such as individualized placement and support for employment and supported employment. Of course, Department of Education has responsibility for our public education system, but as is the case in many states, that functionality is driven a lot by local school systems. And then the Vocational Rehabilitation Agency that here in Georgia is called Georgia Vocational Rehabilitation Agency, or GVRA, provides support for individuals of any disability to return to work, to get a job, to transition from high school, or to keep a job. And those supports can be in a variety of forms. They include technology, they include job development services, they include job seeking services, exploration of what your job interests may be, and they can engage as early as the age of 14 with students who are in school. And I'll turn it to Susanna to talk about USEDs and work incentives.
So every state has at least one USED, just like they have at least one protection and advocacy and a DD council. So I work at our university, one of our 2 university centers, and we really do we're trying to be the bridge between academia, best practices, into the community. And so that can play a role in direct service or through information dissemination, through research projects, research to practice, model demonstration projects, things like that. So we really want to help influence best practices in the arena.
And that last one there is work incentive planning and assistance programs. And if you're not familiar with those, they provide grassroots one-on-one guidance to individuals who receive Social Security benefits, either SSI or SSDI, to anticipate and plan for the impact on benefits when returning to work or with earned income. So they're a wonderful resource and they're available nationally.
Right. So our next slide here, this is going to be one of those quick slides because I want to get into the good stuff. This is really good stuff too. So we look at, this just says Georgia Interagency Efforts, and it has a list of the organizations that during the pandemic, we've really come together to create something wonderful. So we have our DD Council, the ARC Georgia Center for Leadership and Disability, our Protection and Advocacy Program, Georgia Advocacy Office, Spectrum Autism Support, the AT Act, Tools for Life, Families of Children in Distress, which is just called Focus, and then the Down Syndrome Association of America. We have come together, and Susanna and Kate were the some of the masterminds behind our COVID-19 DD network calls, and I'll turn it over to them to go into those details.
Thanks, Danny. We took a card from the playbook of Arizona, and they kind of started off this idea, but we saw a real need to have concentrated information that people could understand in plain language to get kind of away from the noise and all the speculations and really get to the facts and the things that are easy to understand. So our DD Act here, our DD Act programs here in Georgia really have worked really well together on a lot of different projects. And so this was one where we were able to mobilize really quickly and bring on some of our partners who represent other disabilities and other arenas to host. We were doing weekly calls, and as the pandemic has gone on, as kind of information has slowed down, when it all started, there was a barrage of information. And so we wanted to really help people sort through that. And as things slowed down, our calls started to slow down. We really talk about issues and concerns related to COVID-19 and people with disabilities and their families, especially intellectual and developmental disabilities. And we just really wanted to provide clear information and resources to the community. If you're interested in learning more about our calls, GCDD has a landing page, which is the hyperlink is at the bottom. It's gcdd.org/GADD dash network. Kate, anything else you want to say about this?
No, I think you covered it. And yes, to the folks in the chat, someone's already put it in the chat. So thank you for that.
All right.
This is Susanna again. As we talked about earlier, I'm a mental health first aid instructor, and it really is, what we're trying to do is make mental health first aid just as common as CPR, because people's mental health is just as important as their physical health. And so mental health first aid is a skills-based training course that teaches participants about mental health and substance use issues. The training gives you the skills you need to reach out and provide initial help and support to someone who may be developing a mental health or substance use problem or experiencing a crisis. You can find out more about mental health first aid at www.mentalhealthfirstaid.org. And there's also youth mental health first aid too. They have it for individuals who are Spanish speaking as well. There are several trainers at the Center for Leadership and Disability, and I am the point of contact for this training. So I'll put my email in the chat box, and we'll go to the next slide.
Yeah, so this I'm just going to go over quickly, and it's coming together in times of crisis. And these are just going over how some of the different organizations have utilized some of those connection options to make sure that as a community, we're still being informed and we're still staying connected with one another. So Disability Link has done a lot of peer support and events virtually and safely in person when available. The National Federation of the Blind has had a very successful conference. Also, the independent living organizations have really come together to have inclusive spaces for that. And I want to make sure that we touch on grief and loss because we are running out of time.
All right, I can do that. I'm good at talking quickly and hopefully concisely. In general, there is no roadmap for grief or loss. Everyone grieves differently. And this unique situation we found ourselves in, many people are experiencing grief and loss during the COVID pandemic. And it also looks very different than it would if we weren't in the middle of a pandemic. So it makes it even extra difficult. I attended my first funeral via Facebook Live during the pandemic, and it was very different. There are resources through the CDC on coping and grief and loss that there's a link to. Just some ideas of what individuals can do to honor and remember the death of loved ones during this time or any time, but especially now. So make services available via Facebook Live or other streaming means. I've heard of YouTube as well for that. Have a virtual gathering to share memories and a slideshow of their loved ones. Enjoy a favorite meal, snack, or drink that the loved one enjoyed. Light a candle or have a picture at the table during a holiday or other special occasion. And then come up with a tradition to do to honor that loved one on special days. So my mother died about 15 years ago, and I buy yellow roses every year on her birthday and her death day. So there are just different things that you can do. Do what feels right, and try not to do anything that would cause a massive trigger. All right, next slide.
And we did want to just include some mental health resources. We've got some really good stuff from NAMI and the suicide prevention line. There's a Georgia Crisis Access line, and then the SAMHSA distress helpline. So those are going to be available for you to explore. And then
Danny,
we
I just
also
wanted to
have-
say something real quick.
Yes.
So if people don't feel comfortable using their phone calling, there's the text line, and then the Georgia's Crisis and Access line, GCAL has an app that people can use. So it's not just people you call, it can be people that you text or write to in an app.
All right. And so we also have a slide here of just some additional resources that you can look into for stress, stress management, mental health, especially COVID-19 specific resources. So definitely check those out after the presentation. And I'm going to turn things over to Liz to wrap us up.
Thank you so much, Danny, Susanna, and Kate. This webinar was chock full of awesome resources, and really appreciate y'all spending your time with us and the expertise. So we wanted to remind everyone that we've got 2 more webinars in this series. We'll be launching these in January. We've got Making Social Media Accessible for People with Disabilities. And then in early February, we're going to be taking a deeper dive into guidance for businesses and employers considering the needs of people with disabilities during COVID-19. So absolutely check these out, get registered. Let us know if you have any questions. If we can jump to the next, and then the next one. We have our co-host that typed this into the chat. Thank you, Sam, for doing that. But please take a few moments, fill out the survey. We absolutely want to hear from all of you. We want your feedback. Thank you for the thoughtful conversation, awesome sharing of resources, asking questions, and just sharing overall comments to everyone in the chat in today's webinar. Just want to thank our presenters again. Thank you to Hannah for being here, for providing our interpreting, and also to Heather at CIDI for captioning as well too. Carolyn, anything you wanted to wrap us up with?
No, that was just outstanding. And thank you all. Learned so much, and it's been great to see everything that's going on in the chat. So glad to hear this was right on track. So thank you, Kate. Thank you, Susanna. Thank you, Liz, and thank you, Danny. And appreciate Hannah and Heather. So right on. Everybody stay safe and be well.
Thank you all.
Everyone.
Bye, thanks.
Bye.
Bye, everybody. Take care.